Good afternoon, everybody, my dear students. Today we discuss about the metabolism of ketone body. The ketone body is a very important compound which is synthesized in our body, which is supplying the energy in case of starvation and in the crisis of our body. This ketone body generally synthesized in the liver and which is utilized by the extrahepatic or extrahepatic cellular organs in the crisis of like starvation or in the diabetes mellitus. Myself Deepak Kumar Singh, Assistant Professor Calcutta Institute of Pharmaceutical Technology, and in this situation we another request to all the students stay home and stay safe for prevent COVID-19. Now I discuss the metabolism of ketone, how to synthesize and how to degradation of ketone body. Basically in this chapter we discuss about 3 points. One is the ketogenesis, how to synthesis of ketone body, and ketolysis, that means breakdown of ketone body. Another is the ketosis, the condition is called ketosis. These 3 conditions we discuss in this chapter. First, metabolism of ketone body. Carbohydrates are the essential for the metabolism of the fat. Simultaneously, fat is burned under the fire of carbohydrates. Basically, the acetyl-CoA formed from the fatty acid and can enter and get oxidized in the TCA cycle only when carbohydrates are available. During the starvation and the diabetes mellitus, acetyl-CoA takes place in the alternate route of formation of ketone body. What is ketogenesis? The ketogenesis means formation of ketone body. Acetoacetate is the primary ketone body, while the beta hydroxybutyrate and acetone is the secondary ketone body. Now, out of three ketone body, they are synthesized exclusively in the liver mitochondria, and beta hydroxybutyrate does not contain any keto group. Apart from this, it is ketone body, but it acts like a ketone body, and it contains alcoholic group. The names therefore the misnomer, but it is used function as like a ketone body. So we see that there is a 3 structure of ketone body. One the acetone, acetoacetate, and beta hydroxybutyrate. In this structure, acetone and acetoacetate which contain keto groups, that is ketone body. That's why it is called the true ketone bodies. And beta hydroxybutyrate which is contain alcoholic group, not keto groups. That's why it is called the false ketone body. But though it is a false ketone body which acts as a ketone body as like as acetone or acetoacetate. The formation, utilization and excretion of ketone body. We see the structure. Generally we see the structure and the pathway by which it will be utilized in the liver, blood and extrahepatic tissue. The first one is the acetyl-CoA and the glucose in the liver which is converted to acetyl-CoA. Then the excess acetyl-CoA which is get into the citric acid cycle or TCA cycle and the produce carbon dioxide, and excess acetyl-CoA which is converted into a ketone body, and that excess ketone body which is entered into the blood stream, and this ketone body is in the form of acetoacetate or in the lungs, and another excess, if I higher the excess, it will be excreted through urine. Then this ketone body goes to the extrahepatic tissue. Another pathway is the free fatty acid which is converted to acetyl-CoA either in the blood to liver or it goes to the extrahepatic tissue, is converted into acetyl-CoA. And the glucose, that means acetyl-CoA and excess glucose, ultimately it converted into the acetyl-CoA. This acetyl-CoA or these ketone bodies which you see the picture, this acetyl-CoA, then again we TCA cycle under the crisis period, that means in the case of starvation or in the diabetes mellitus. First of all, the ketogenesis, how to formation of ketone body. Generally, 5 steps are involved in this reaction. First, the condensation, then production of HMG-CoA, hydroxymethyl-glutarallyl-CoA. Number 3, lysis. Number 4, the reduction and the spontaneous decarboxylation. So we start from the condensation. The two molecules of acetyl-CoA, just it will be seen in the pathway by the ketone body. Here we given the two structure, and these two picture come from the different books for the betterment, for better understanding of the students. First of all, 2-acetyl-CoA, which is condensation by the presence of acetoadenyl-CoA synthase, it formation of acetoacetyl-CoA. Then another acetyl-CoA in the steps 2, which is converted into a beta-hydroxy beta-methyl glutarallyl-CoA. Then another step 3, which is the HMG, most important steps, beta-hydroxymethyl glutarallyl-CoA lyase with formation of acetyl-CoA. This acetoacetate, which is converted spontaneously by the non-enzymatic reaction, it is converted into acetone. Another, in the presence of step 4 by the dehydrogenase, is converted into the beta-hydroxybutyrate. That means excess acetyl-CoA ultimately converted to acetoacetyl-CoA, acetoacetate, it is converted to acetone, and then another enzymatic reaction or dehydrogenation reaction, it takes place, it is a beta-hydroxybutyrate. That is 3 ketone body will be formed by the ketogenesis. Then we see the another picture how free fatty acid to acetyl-CoA, then acetyl-CoA will be formed, and the triglyceride also acetyl-CoA, then acetyl-CoA goes to the beta oxidation, and the thioenzyme, the acetoacetyl-CoA to acetyl-CoA goes to the TCA cycle, and finally this acetyl-CoA and hydroxymethyl-CoA, ultimately these are the excess acetoacetate, which is in the presence of a hydroxymethyl dehydrogenase is converted to beta hydroxybutyrate. In the another book from the Steyer or Harper, ketolysis. This is another important is the ketolysis, that means breakdown of ketone body. This is the utilization and synthesis, it is the ketolysis, that means breakdown of ketone body. The ketone body are formed in the liver, but they are utilized in the extrahepatic tissue. The heart muscle, renal cortex prefer the ketone body to glucose as fuels. Tissue like skeletal muscle or brain can also utilize these ketone bodies as an alternative source of energy. If glucose is not available, such as starvation, acetoacetate is activated to acetoacetyl-CoA by the enzyme thiophorase enzyme. Ultimately, ketone body will be converted to acetyl-CoA. This acetyl-CoA goes into the TCA cycle, ultimately get the energy. In this case, almost all the tissue and cells used to ketone body as fuel. With the exemption of the liver and the RBC, the placenta can also ketone body as fuel. Intestine mucosa cell, brain, adipocytes, and ketone bodies, skeletal muscle, heart, liver, etc. primarily utilize the fatty acid during the starvation. Basically, in the case of starvation and the diabetes mellitus, ketone body will be utilized. And in this case, the ketone body acetoacetyl plus succinyl-CoA in the presence of thiophorase, the acetyl-CoA succinate is formed. This acetyl succinate to succinate, it goes into the TCA cycle. There is a utilization of the ketolysis, in this case the blood and the liver and the extrahepatic tissue. Free fatty acid converted to acetyl-CoA in the liver, and it is converted in the ketone body, and ketone body goes to the blood's excess. This ketone body, which is the acetone in the lungs, and in the ketone body in the urine, it is excess. Then another excess ketone body which is stored in the body as a ketone body, then is converted to acetyl-CoA. Acetyl-CoA is converted to citric acid cycle or TCA cycle, ultimately carbon dioxide and produce some energy. That is the ketolysis. The another significance of the ketone bodies, the lipid droplets, the high hepatocytes basically utilize this ketolysis as well as the ketogenesis. In this case, the acetyl CoA, which is formation of the acetoacetyl or beta hydroxyacetone, these acetoacetyl and beta hydroxybutyrate is as a energy source for the heart, skeletal muscle, kidney, and the brains. And the another oxaloacetate is another glucose, which is glucose is exported as a fuel for the brain and the others. We know that the brain has renal cortex, which are totally dependent on the energy of glucose. But if it is crisis, in the case of crisis condition, this acetyl CoA again converted into the glucose from the free fatty acid and supply for the energy. And if the better utilization for this figure free fatty acid from the liver and liver to muscle, how to utilize, to see just the picture which is understand for you. And the ketosis, another most difficult, the ketosis. The normally the rate of synthesis of the ketone body in the liver in such that they can be easily metabolized by the extrahepatic tissue. Hence the blood level of ketone bodies is less than 1 mg per dl, and only the traces of are excreted in the urine, not detected by the urine. But when the rate of synthesis exceeds the ability of extrahepatic tissue to utilize them, there will be accumulation of ketone body in the blood. This leads to ketomia. That means the excess ketone body which is present in the blood, it is called the ketomia. And when it is excreted through urine, it is called ketonuria. And when the smell coming in the breath, it is called acetone smell. All these three together constituent of condition is called the ketosis, ketomia, and breathing of acetone breathe in the lungs or in the ketonuria, all according to is called the ketosis. What is the cause of ketosis? How to ketosis will be occurred? Generally, two condition is responsible for the ketosis. One is the diabetes mellitus. In this case, the untreated diabetes mellitus, it is the most common cause of ketosis, because in the diabetes mellitus generally the deficiency of the insulin, and insulin can increase the aggravate or increases the blood glucose level, and this glucose, excess glucose, which is converted into a ketone body. Then ketone body which is produces ketone body which is stored in the body, accelerate the lipolysis and more the fatty acid and release into the circulation. Another is the starvation. In this case also there are just two different things, but in the case of starvation, their dietary supply of the glucose is decreased, and in that condition the lipolysis will be occurred from the adipose tissue. The excess free fatty acid will become from the adipose tissue. This free fatty acid again is converted into the acetyl CoA. Then acetyl CoA again it is converted to ketone bodies. So there are the two causes. One is the diabetes mellitus, another starvation or prolonged starvation. It causes ketosis. There is some silent feature of the ketosis. First, metabolic acidosis. That means acetoacetate and beta hydroxybutyrate are the acid which is accumulated, and metabolic acidosis or will be occurred. Reduced buffer in the plasma bicarbonate, it is used for the buffering for the acids. Generally, the bicarbonate buffer can be hampered by the ketosis. Another is Kuss manual respiration. Patient will be have some typical acidory breathing of the compensatory of the hyperventilation. It is called the Kuss manual respiration. And another is the smell of acetone in the patient, generally in case of high starvation or prolonged starvation. In the last stage, in that case the acetone will be released from the lungs, and the breathing will be acetone smell will be come from the breathing. And osmotic diuresis induce the ketonuria, may lead to dehydration, sodium losses. The ketone body can excrete the urine as their sodium, leading to loss of cation from the body. Dehydration also, ketosis produces the sodium losses, further aggravation of the dehydration. And finally, most important feature is the coma. Hypokalemia, that means deficiency of potassium, dehydration and acidosis are contributing for the lethal effect of ketosis. How to diagnose the ketosis? Generally, it will be not detected, but when it is excreted through urine, that means in case of ketonuria, The test, Ruthera test, is the diagnostic test or confirmatory test for the ketone body, excess ketone body released by the urine. Ruthera test, it is a very simple test by which you take just 5 ml of sample of urine and solid added with the solid ammonium sulfate. Add a few drops of freshly prepared sodium nitroprusside and followed by 2 ml of liquor ammonia. Along with the side of the test tube, develop a purple ring, indicates the presence of the ketone body in the urine. And strip tests based on the same principle are available also, but Ruthera test is the very positive test for the diagnosis of the ketone body. How to management of the ketoacidosis? Generally, it is occurred in the diabetes mellitus ketoacidosis. The treatment which is given by the either inject insulin or in the glucose. When the glucose or the insulin are given intravenously, potassium is trapped within the cells. Hence, the clinicians should always monitor the electrolytes, because when the insulin is incorporated or administered or glucose is administered, in this case there is a chance of hypokalemia, and that's why electrolytes monitoring is very important. Another important management of ketoacidosis by the administration of bicarbonate to maintain the electrolytes as well as the fluid balance are very important aspects. For the explanation of ketogenesis, previously in the first we discuss about the ketogenesis, but in this case during the starvation, where ketogenesis will be occurred during the starvation, diabetes mellitus, and the blood level of glucose is increased, and glucagon inhibits the glycolysis, activation of glucogenesis, activation lipolysis, and decrease the manolyl CoA level and stimulate the ketogenesis. And high glucagon insulin ratio is the potential for the ketogenic. Insulin has the opposite effect. It favors glycolysis, inhibit glucogenesis, and depression of lipolysis, and increase manolyl CoA level and decrease the ketogenesis. And the ketone body form in the regulatory as follows in the level 3. Where see it, the structure, the lipolysis and the entry of fatty acid by the mitochondria and oxidation of acetyl CoA. These are the picture, we can see it. There is a starvation or the diabetes mellitus. There is a total 3 steps. Level 1 lipolysis, and level 2 increase carnitine acyl transferase 1, or level 3 decrease the glucogenesis, or in case of starvation directly ketone body is formed, or by the another 3 process or 3 level 1 to 3 which is directly increase the ketone body. Let us, we can thank you for patience, and thank you for now. Today is the another is most important day for Bengali people, basically the first বৈশাখ। তো সেই বৈশাখ মাসের শুভ নববর্ষের সবাইকে আমার প্রীতি ও শুভেচ্ছা জানিয়ে আজকে এখানেই আমরা ক্লাস শেষ করলাম। ওকে, থ্যাংক ইউ ফর ইয়োর পেশেন্স। থ্যাংক ইউ।